Have you had an MRI, a CT, or even an X-ray because of your back pain and the report has mentioned a pars defect or pars fracture? My name's Anthony Ghosh, I'm a consultant spinal neurosurgeon and founder of the Spine MDT. In this video, I'm going to explain what a pars defect or pars fracture is and how we treat it. Whilst this is a repetitive strain injury that often happens in adolescence or young adulthood, it's not uncommon for symptoms to develop a lot later in life, possibly in our 50s and even our 60s. Here's a picture of the lumbar spine, the lower back area. Here's the front. Here's the back. The spine is made of a stack of bones called vertebrae, which are cylindrical blocks of bone with an arch of bone at the back and an overhanging bit of bone connecting to the bone below, forming what we call the facet joint. The piece of bone between the two joints is known as the pars, and at this level here we can see a defect in the pars. Some people are genetically more pre-exposed to it by having thinner bones, but there are activities where repetitive hyperextension or rotation of the spine can predispose you to it. For example, fast bowlers in cricket or gymnasts. If these activities are carried out during the adolescent growth spurt whilst the bone is thinning and growing, that's when it's a bit more predisposed to it. Often in my practice I see two phases in life when this problem can become symptomatic. The first is in young adulthood and adolescence, where patients often have a very focal, localized area of pain. Most of the time in this early phase, physiotherapy to build a muscular brace around the segment is all that's needed and things settle down, but rarely surgery is required just to repair the fracture with a small construct around it that still allows motion of the rest of the spine. The pars fracture itself is often referred to as a spondylolysis, which isn't to be confused with spondylolisthesis, which is a later complication that can happen as a result of this fracture. Spondylolisthesis is what happens when one bone, demonstrated here, moves forward over the bone below it, because this bone here, the pars connecting the two joints together, is what helps preserve the normal alignment of the spine. So later in life, the symptoms that may develop could just be a very localized focal area of back pain in the region of the fracture where things may have become inflamed or strained once more. Just beneath this bone is a channel, demonstrated here in the bone below, through which a nerve leaves the spine. If that nerve is irritated or compressed around the fracture area, that can also cause pain that radiates down your leg. If a spondylolisthesis develops, i.e. one bone moves forward, you can develop a more generalized back pain throughout the lower back that's worse on standing, bending, lifting things or walking for a period of time, or even turning in bed at night. And again, that can cause nerve compression and pain that travels down your legs. In terms of treatment, exercise therapy, again, where we're trying to build a muscular brace around that segment of the spine, can often be quite effective. In parallel, pain management, which may even include an injection to the spine, especially for nervous traps, can be helpful in giving us a break in the pain cycle so that we can actually carry out the physiotherapy exercises effectively. Then we have the surgical options if the above measures fail. And here's my protocol. If the alignment of the spine is still well maintained, but we're confident from all the tests we've done that your pain is coming from the pars defect or pars fracture, then we can simply repair that fracture. This type of surgery is minimally invasive and the construct itself is quite small. We have to complement this with physiotherapy to maintain that muscular brace around the spine and maintain stability. If there is a spondylolisthesis where one bone has slipped forward, then the operation I propose is a minimally invasive interbody fusion where we join the two bones together with a construct of screws and two rods and an implant that sits in the disc space, allowing the bones to fuse together over time. And again, an exercise therapy program during the rehabilitation period is vital in helping you getting back to the things that you enjoy. I really hope you found this video helpful. If so, please click that like button and do subscribe to the channel. Also visit us at spinemdt.com to see how we can help you. Thank you very much for watching.